morning, Jepi. Thank you for helping us to improve our knowledge about Staphylococcus.
You're welcome. It's a pleasure.
Now I'm going to ask you some questions about it. How do you get this illness?
First, I think it's important to describe briefly this illness. Staphylococcal food poisoning is a gastrointestinal illness. It is caused by eating food contaminated with toxins produced by Staphylococcus aureus. And how food could be contaminated by Staphylococcus aureus? The most common way for food to be contaminated with Staphylococcus aureus that produces enterotoxin, because not all the Staphylococcus aureus produce enterotoxin, is through contact with food workers who carry the bacteria in their noses or on their hands via manual contact or through respiratory secretions. In fact, Staphylococcus aureus is a common commensal of the skin and mucosal membranas of the humans. And these colonized asymptomatic humans are called carriers. Another source is through contaminated milk and cheeses. Another sources of food contamination is the equipment and surfaces of which food is prepared can also serve as vehicles in the transfer of Staphylococcus aureus to foods.
Okay. What are the steps on contracting this illness?
After Staphylococcus food contamination by manual contact or through respiratory secretions by food handlers, either carriers or with the skin or nose infections or contaminated milk, if food is incompletely cooked or left at room temperature, the bacterium multiplies in food and produces toxins that can cause illness. Staphylococcus is killed by cooking and pasteurization but staphylococcal toxins are resistant to heat and cannot be destroyed by cooking. Then, it is important to prevent the contamination of food with Staphylococcus before the toxin can be produced. For this reason, foods at higher risk of contamination with Staphylococcus aureus and subsequent toxin production are those that are made by hand and require not cooking. Some examples of foods that have caused staphylococcal food poisoning are sliced meat, puddings, some pastries, and sandwiches. And despite contamination, they have a normal taste and odor.
And can you tell me any symptoms?
Staphylococcal enterotoxins are fast-acting, sometimes causing illness in as little as 30 minutes. Symptoms usually develop within 1 to 6 hours after eating contaminated food. Patients typically experience several, not all, of the following symptoms: nausea, vomiting, stomach cramps, diarrhea. In more severe cases, dehydration, muscle cramping, and changes in blood pressure and pulse rate may occur. This illness is usually mild, but in a small minority of patients, it may be more severe. How severe they are depends on your susceptibility to the toxin, how much contaminated food you ate, how much of the toxin you ingest, and your general health. For example, could be more severe when infants, elderly or debilitated people are concerned. The disease is usually self-limiting and typically resolved within 48 hours after onset. Okay.
How can you prevent it?
It is important to prevent the contamination of food with Staphylococcus before the toxin can be produced. We need to wash hands and under fingernails vigorously with soap and water before handling and preparing food. Do not prepare food if you have a nose or eye infection. Do not prepare or prep food for others if you have wounds or skin infections on your hands or wrists. Keep kitchens and food serving areas clean and sanitized. If food is to be stored longer than 2 hours, keep hot foods hot over 140 Fahrenheit degrees, or cold food cold 40 grades, 40 Fahrenheit degrees